Welcome back to Neurovascular Nuggets, everyone. I'm Prof. Mansoor, and today Sama and I are diving into a really insightful paper, one that I think is incredibly relevant to a significant portion of our population, women's health, particularly around menopause and brain health.
Thanks, Prof. I'm Salma, and I'm really looking forward to this discussion. It's an area that honestly doesn't get as much attention as it should sometimes, especially when we talk about brain health in women. What's the core focus of this paper we're looking at today?
Absolutely, Salma. You hit the nail on the head. This particular study used cross-sectional MRI to examine cerebral blood flow, or CBF, in women across different menopausal stages, premenopausal, perimenopausal, and postmenopausal, and compared them to men of similar ages. It's a really robust approach to understanding these intricate differences.
So, comparing different stages of menopause to men, that sounds like a great way to isolate the impact of these hormonal changes. What were some of the standout findings right off the bat?
One of the most striking findings was that premenopausal women, surprisingly to some, actually had significantly higher CBF, and we're talking about higher flow across the whole brain, including the gray matter and even the white matter, compared to both the peri and postmenopausal groups, and also compared to men in the study. That's a pretty big difference.
Wow, so premenopausal women have this supercharged brain blood flow, if you will. That's really interesting. And then what happens as women transition through menopause? Does that high CBF continue?
Unfortunately, no. The study clearly showed a different picture. Perimenopausal and postmenopausal women showed a notable decline in CBF, but perhaps even more concerning, they also had a higher prevalence of white matter hyperintensities, or WMHs, compared to premenopausal women and men. These WMHs are essentially indicators of small vessel disease and can suggest underlying cerebrovascular issues.
So as CBF goes down, these white matter hyperintensities go up. That seems like a pretty clear trend, doesn't it? It's like the brain's plumbing is starting to show signs of wear and tear as women enter and progress through menopause.
Precisely. And to dig a bit deeper into the mechanics, the researchers performed a multivariate regression analysis. This sophisticated statistical method revealed that menopause status itself, and perhaps even more critically, the interaction of age and menopause status, significantly impacted CBF. It's not just age and it's not just menopause, it's how they intertwine that seems to drive these changes.
That interaction part is key. It implies that for women, getting older isn't just about general aging processes for the brain's blood supply. It's fundamentally altered by the menopausal transition. So what did they see in terms of how CBF changes with age within these different groups?
Great question, Salma. It gets even more nuanced there. The study observed that premenopausal women actually showed slight increases in CBF with age. Think about that for a second. As they got older, still premenopausal, their brain blood flow was slightly improving. But in stark contrast, peri- and postmenopausal women exhibited clear declines in CBF as they aged. It's almost like a switch flips once that menopausal transition begins.
That's fascinating and a bit concerning. So, what are the big clinical implications of all this? How should we or clinicians interpret these findings in terms of patient care?
The implications are quite significant, Salma. First and foremost, these findings suggest that alterations in brain perfusion don't just magically appear later in life. They likely begin as early as perimenopause. This is a critical window, and these changes are possibly linked to the increased WMHs we discussed. It's like an early warning sign.
An early warning sign indeed. So, if these changes start in perimenopause, does that mean we should be actively looking for them during that time?
Exactly. Another crucial implication is that monitoring brain perfusion changes in perimenopausal women could be a powerful tool. It could help us identify those women who are at a higher risk for cerebrovascular disease before more severe symptoms or conditions develop. It shifts the focus from treatment to proactive risk identification.
That makes so much sense. Prevention and early intervention are always better than reacting to a crisis. So, beyond just monitoring, what can be done? Are there strategies that could help maintain better brain perfusion?
That's the million-dollar question, isn't it? The study certainly points towards the need for strategies to maintain better brain perfusion during this menopausal transition. If we can achieve that, it may help significantly reduce future cerebrovascular risk. This could involve everything from lifestyle interventions like diet and exercise to potentially hormonal therapies or even novel pharmacologic approaches, though more research is needed to pinpoint the most effective strategies.
It's exciting to think about the possibilities there. And if CBF is such a clear indicator, could it become a standard part of assessing risk?
The paper certainly proposes that. They suggest that CBF could be a very useful neuroimaging biomarker for assessing cerebrovascular risk specifically during the menopausal transition. Imagine, instead of just looking at traditional risk factors, we could have a direct measure of how the brain's blood supply is performing, giving us a more comprehensive picture.
That would be a huge step forward for personalized medicine in women's health. So, what's next for this area of research according to the authors?
They rightly emphasize the need for longitudinal studies. This cross-sectional study gives us a fantastic snapshot and highlights strong associations, but to truly understand causality and the progression of these changes, we need to follow women over time. We need to clarify exactly how these menopause-related CBF changes correlate to long-term outcomes like stroke risk, cognitive decline, or even dementia.
That makes total sense. Following individuals over many years is crucial for understanding dynamic processes like aging and hormonal shifts. So, if I'm a woman approaching or in perimenopause, what's my big takeaway from all this?
Your big takeaway, and really for all clinicians and patients, is that menopause isn't just about hot flashes and mood swings. It's a systemic change that profoundly impacts every part of the body, including the brain's vascular system. It highlights the importance of discussing brain health with your doctor during this period and really emphasizing preventive strategies from a holistic standpoint. Don't ignore those subtle changes. They could be early indicators of something more significant unfolding.
That's a powerful message, Prof. It really elevates the conversation around menopause from just symptom management to crucial long term health planning. It's about empowering women to understand these changes and advocate for their health. I mean, knowing this information, it changes how you might view your own health journey.
Precisely. And I think that's the essence of what these neurovascular nuggets aim to do: bring cutting edge research to the forefront, make it accessible, and underscore its real world impact. This study specifically opens up so many avenues for targeted interventions and better diagnostic tools for women's brain health.
Absolutely. It's a call to action for more research, more awareness, and better clinical practice. Thank you, Prof. Mansoor, for breaking down such a complex and vital topic so clearly today. This has been incredibly insightful.
My pleasure, Salma. And for everyone listening, if you want to dive deeper into the paper we discussed, you can find the link in the show notes and on our social media channels under Neurovascular Nuggets. We encourage you to read the full study yourself. Until next time, stay curious and keep learning.
Thanks for tuning in, everyone. We'll catch you on the next episode of Neurovascular Nuggets. Take care.